So crash cart means, no? What is crash cart? Usually dispensing emergency medications. Okay, it might be a trolley, it might be a box, it might be anything, it might be just a boxes or tables. The crash cart won't have certain structures. Crash cart will have all the opening pedals, we'll keep all the emergency medication at the stretch, and we'll divide according to our requirements. It might be different from one department to other department, and we don't have particular structure or particular boxes or particular structure for the crash cart. Mainly we have the primary drugs and the secondary drugs. Primary drugs and secondary drugs are life-saving drugs, usually which will be from the adrenaline, atropine to adenosine, cardron, calcium gluconate, and soda bicarbonate, laxicod. All these drugs are life-saving drugs, emergency for cardiac purposes when patient get cardiac arrest, patient have a respiratory arrest. And secondary drugs are the supportive drugs which also alleviate the symptoms when there is patients come with low hypertension, like hypertension will be used noradrenaline. When a patient comes with certain inotropic drugs are commonly used with dilutions. Okay, these are the high concentrated drugs. That's why we always label them as high concentrated drugs, high risk medications. You can see here. And there are medications like lookalike sound-alike medication that we need to label, because certain medication like adrenaline, atropine, they sound similar and they look similar. So that's why we need to label them. So lookalike and sound-alike medications. So in our Suyo hospital, we have 6 cabins, an open tray, and 5 floors. You can say the 5 floors: 1, 2, 3, 4, 5 floors. Okay, so that each floor we will keep what are the necessary requirements. In the top we kept ambu bag with extension, oxygen extension, and laryngoscope. In the second compartment we have all type of syringes, from single syringe, 2 ml, 3 ml, 1 ml, 5 ml, and 10 ml syringes, which will be used according to the use. And in the third floor we have main defibrillator. Okay, our Philips defibrillator has both. It's a biphasic defibrillator which has 0 to 200 joules. In the biphasic, we have to use we have 2 types of defibrillator: biphasic and monophasic. Monophasic means single paddle. Okay, this is a biphasic defibrillator where two paddles will be present. We have both adult and pediatric paddles. You can see this is an adult paddle. Okay, so similarly there is a pediatric paddle. Okay, both you can use. Okay, every day you need to check the functioning of defibrillator, which is very important, because this is one of the life-saving thing. We need to a defibrillator which is working, which is power supply is correct. Whether it's every day you need to pre-check this. In each shift you have to pre-check whether it is working or not working. Okay, there is an option here in the menu. You can go and you can have an option like operation check. You can do a run of operation check here, so that whether the defibrillator is working or not. You can provide a shock. Okay. Then in the in the fourth compartment, we set all the airways like primary drugs and secondary drug as mentioned. All the drugs have been given. In the fourth compartment, we have oral airway contents like ED tubes, oral airway, suction catheter, and all the 14 French to 14 to 60 French catheters. We have different sizes of endotracheal tubes from 4 to we have up to 9. Okay, that's different sizes of endotracheal intubation, endotracheal tubes we have, and oral airways like adult airways and pediatric airways both we have actually. In the disposable set, disposable things what we use for IV fluids like IV sets and Vasofix, Easifix, and all gauges of Vasofix are available from 24 and up to 60. Okay, and then extensions like PMO line, pressure monitoring line for the larger bolus infusion and connector, all these stuffs. And in this, and IV fluids and isotonic solutions are present like normal saline, single lactate, dextrose, and we have an also starch solution, or you can call it as an expovan, which is used when there is a patient with a hypovolemic shock. Large amount of fluids need to be replaced, so by the time you can use the expovan or starch solution, And we also have 25% dextrose when patient comes with hypoglycemia, severe hypoglycemia, you need to use such. And fifth, sixth compartment has accessories. Accessories are like oral masks, and we will have the Magill's forceps when there is a difficult airways. You can use the Magill's forceps in order to pull a Ryle's tube, or in order to insert a Ryle's tube, or else in order to replace the endotracheal tubes we can use. And also we have the biohazardous bags in the accessories in order to properly dispose the biomedical waste segregation. And the last compartment, the final compartment, in the down compartment, we have kept all the ammo bags, which are necessary things. So we have readily kept for the intubations. Okay, these are the things, whatever the things required for medication, like what medications and other the airway consumables and suction catheter, which is extra required because in the emergency we can't go and find certain tubes or certain types of consumables. We can't go open the cupboard and we can't find, so that they have readily made an intubation set which is available in the crash cart. Okay, crash cart is thing which is consists of all the life-saving equipments and the medications which will be used when there is emergency situations like cardiac arrest, respiratory arrest. It might be for any cardiac or medical, like surgical emergency or medical emergency, any type of emergencies. Okay, to save the life of our patients.